So there'll be no surprise that I wish to create a new area and a new Vice Chair on global health and social accountability. And I'm pleased to advise that Catherine Rouleau has agreed to take on this role. Catherine will continue to lead our global health area, which will be expanded to cover global health and social accountability, and which will, among other things, include a specific focus on our department's contribution to improving the health and well-being of Indigenous Canadians. Our department already does extraordinary work in supporting family medicine development around the world. Our current programs include contributions in China, South America, the Caribbean, the Middle East and Africa, including our support for the development of family doctor training in Ethiopia. I want to grow our international offerings and also increase the opportunities for international visitors to participate in all of our programs here in Toronto. I'm also keen to strengthen our involvement with key global health organisations, including with our partners and friends at the World Health Organization. Global health, of course, begins at home, and I want to strengthen our focus on our contributions towards addressing the social determinants of health and the work of many of our faculty in working with vulnerable and marginalised populations in Toronto and in rural and remote Ontario. I've been especially impressed with the focus of some of our faculty on addressing inner city health challenges such as HIV primary care, addiction medicine, the care of people who are homeless, people who are poor, adolescents, people who are refugees and new immigrants. These are issues with global implications, and we need to be sharing our research findings and experiences with the rest of the world. Since arriving in Canada, I've been impressed by this nation's genuine movement towards truth and reconciliation with Indigenous peoples. As a leading academic department, we have a role to play in this process, especially in efforts to improve the state of Aboriginal health in Canada. I want to work with you to define our role in improving Indigenous health across Canada. I want this department to be a safe and respectful place that embraces this nation's Indigenous peoples and heritage. I want this to be the #1 choice of family medicine residency training for Indigenous medical graduates, and to see if we can set a quota for entry by Indigenous students, and also a quota for entry by students of refugee origin. I'd like to have all our faculty and staff and residents culturally aware, culturally sensitive, culturally appropriate. We have an extraordinary opportunity to support these nationwide developments, especially given that we have 2 of our faculty in the Canadian Ministry, as Canada's Minister of Indigenous Services, the Honourable Jane Philpott, and Canada's Minister of Crown and Indigenous Relations and Northern Affairs, the Honourable Caroline Bennett. As a newcomer to Canada, I've got a lot to learn about the diverse Indigenous peoples of Canada, and I'll be looking for your support in implementing these initiatives. I'm pleased to advise that faculty members like Janet Smiley are keen to engage with us on this endeavour. I want our medical students and our residents to see our commitment to social accountability in action, and I want to support preparing them to work where they're most needed, either in Canada or around the world. This department has a great track record of commitment to social responsibility for us to build on.